Sure. 1, 2. You don't think I could count to 10, Mike?
Oh, I know you can. Very capable.
Yeah. Okay, we're good to go? Great. Thanks, everyone. Good morning. It's John Horgan, joined by Minister Harry Bains, coming to you from the unceded territory of the Coast Salish people, the Songhees and Esquimalt First Nations here at the Legislative Assembly. As you all know, I've been advocating for a national paid sick leave program since the pandemic began at the beginning of last year. I raised the issue with my colleagues at provincial councils. I raised the issue directly with the federal government through the Prime Minister and the Minister of Finance. I didn't have a lot of support at the beginning, but I was gratified when the federal government announced that they would bring forward a program to assist workers to make that tough choice between staying home when they're sick or going to the workplace, putting their colleagues and others at risk of contracting COVID-19. Unfortunately, the federal program has been difficult to access for workers. We raised the issue with the federal government. We were hopeful in the last federal budget that they would have corrected that problem, and unfortunately, they weren't able to do so. So as a result, the province is going to step up and fill that gap. No one should have to make that difficult choice between staying home when they're sick or going into work because they have an economic imperative to do so. Today, we're making that choice a little bit easier. Earlier this morning, the minister tabled Bill 13 that will support hard-hit businesses and make sure that workers don't have to make that tough choice. And we are going to, as of today, introduce 3 days of paid sick leave to the end of the calendar year. This will ensure workers will not lose pay. The relationship between the employer and the employee will remain the same, and working through the WorkSafe administration process will be able to reimburse those businesses as quickly as possible. This is one of the challenges with the federal legislation. There was a gap between the time you took off and your ability to access the program. The federal government allocated $2.6 billion for a national program and have only been able to get $400 million out the door. That doesn't speak to the lack of need for the program. That speaks to the inadequacy of the construction of that program. And I will continue to work with the federal government to see what we can do about improving that for the long term. But as long as we have COVID-19 in our communities, we want to make sure that workers, businesses, and communities are safe. We're going to be consulting over the next 6 months with workers, with industry, with Indigenous peoples and others to develop a long-term program. COVID-19 does not end the fact that we have a gap in our employee-employer relationship that puts people at risk. This is an opportunity to fix a problem that's been in existence for a long, long time. We're excited about doing that in collaboration with all parties. Paid sick leave is good for businesses, it's good for workers, and it's good for communities. And together, it'll help us come out of the COVID-19 pandemic stronger than we went in. I'm very excited to have the opportunity to talk to you about this issue today. I'll ask Minister Bains to say a few words before we go to questions and answers.
Thank you, Premier. I would also like to acknowledge that we are gathered on the territory of the Lekwungen-speaking people of Songhees and Esquimalt First Nations. I would like to add to what Premier Horgan has said about the legislation we introduced today. As provided some additional, and I will provide some additional details about how it will work. There are two parts to this legislation. The first is an immediate measure to support workers and businesses as we continue the battle against this pandemic. The amendment will provide up to 3 days of sick leave related to COVID-19 at full pay. This includes circumstances for any worker who self-isolates when they feel ill, who has been exposed to the virus, stays home to follow public health guidelines, or is awaiting test results. We know that the most important and effective way to prevent transmission of COVID-19 is to stay home and self-isolate. This leave is good for workers, good for businesses, and will help our economy recover faster. At the same time, we know that many businesses are also struggling to survive. That's why the new COVID-19 paid sick leave will include province reimbursing businesses up to $200 per day per employee. Employers will be required to pay their workers their regular wages, and government will reimburse them up to $200 a day per worker. If a worker is sick for longer than 3 days, this program bridges the gap to the federal Canada Recovery Sickness Benefit that provides up to 4 weeks of support. This means workers won't lose pay when they feel unwell, hard-hit businesses will get support they need, and together we will stop the spread of this virus. Unlike other jurisdictions, BC COVID-19 paid sick leave will remain in place until December 31st of this year, by which time the pandemic should be behind us and we will be focusing on economic recovery and rebuilding. WorkSafe BC will administer the employer reimbursement program on behalf of our government, which funds provided by the government. I would like to take the opportunity to thank WorkSafe BC for its quick action in stepping up to administer this program. The pandemic has highlighted how difficult it is for workers, many who are already living paycheck to paycheck. And those difficulties will not disappear when pandemic ends. The second part of this bill better support workers and healthy and productive workplaces in the long term beyond the pandemic. For the first time ever in BC, we're creating a permanent province-wide paid sick leave for workers who cannot work due to illness or injury starting January 1st, 2022. This builds on amendments we made in March 2020 to add 3 days of job-protected leave, sick leave that will last beyond the pandemic. We will be consulting extensively to develop a permanent model for sick leave that will be fair and reasonable. Businesses know that a healthy workforce is a valuable asset. We will consult with business groups, labor groups, and other stakeholders as we develop permanent sick leave model. And we will find a balance that works for everyone, that protect and support both employer and workers. This permanent paid sick leave will be in place starting January 1st, 2022. Our Premier, John Horgan, promised a Made in BC paid sick leave program, and today we are here delivering on that promise. Thank you.
Thanks, Harry. And now Lindsay will entertain your questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You'll be limited to 1 question and 1 follow-up. First question is from Justine Hunter, Globe and Mail.
Thank you. Premier, I don't know that legislation is typically written in a matter of weeks, so I'm wondering if you could just working on this. When did the government start drafting, working on putting together the administration?
Well, thank you, Justine. I got every third word there, but I think what you asked was, when did we start working on the legislation? And I can say we started working on the legislation last year, and we have been looking at how best to deliver a program like this when we saw the shortcomings of the federal program. And I want to reiterate that the Prime Minister and the Deputy Prime Minister, now Finance Minister, when we first discussed this, she was responsible, Minister Freeland was responsible for intergovernmental relations. And they were both enthusiastic supporters of this because they saw the challenges of a second wave, and of course we hadn't contemplated a third wave, but the importance of making sure that workers and businesses were protected. And I firmly maintain that a national program is still in the best interest of workers and businesses. But for now, we needed to bring this forward, and we started that work last year. And when the federal budget was tabled without any appreciable change in how the federal government would respond to this issue, Minister Bains got into action with ledge drafters, finalized the bill, worked with WorkSafe to administer the program. And I want to just reinforce Minister Bains's comments. This is not normally what WorkSafe does. These are provincial dollars that will be administered by them, and we're very grateful that that administration is in place to help us deliver this program.
Justine, do you have a follow-up?
Thanks, and I'll try and lean in if you can hear me better, I hope. I know you're still going to work on the permanent model and there will be consultations, but is there a model that you're aware of where the employer isn't responsible for sick pay? I'm just wondering if it's inevitable that they will be, in the long term, taking on this additional program.
Well, I have to confess, Justine, that over the past 4 years, if I've learned anything, it's that nothing is inevitable. And I may well have felt that way in the past, but I certainly don't feel that way today. And I am anxious to work with employers, whether they be through umbrella organizations, the Chambers of Commerce, the BC Business Council, any number of individual businesses, to talk about this, because it is in their interest. And you've seen that. The Surrey Board of Trade today, after seeing the legislation, applauded its introduction and spoke about the importance of building on that. And we need to do it in a collaborative way. And I'm confident that Minister Bains, working with industry, workers, and other stakeholders, will come up with a model that will work for everybody. But this is a challenge that I think is best handled at the federal level, and I'm going to continue working with the Prime Minister to try and convince him and my colleagues across the country that this is something that we need to do now. The pandemic has shown us the way. Let's just do it. Protect workers, protect businesses.
Next question is from Binder Sargent, CTV.
Premier, so you spoke about how for more than a year you've been thinking about a sick pay program and how important this is. Of course, in the hardest hit region, and particularly in Surrey, we have a lot of essential and lower income earners. And many of the people who follow these types of programs say these are the groups that will be helped the most. So what do you say to people who say you shouldn't have followed the federal government and that you could have stopped a lot of infections if you had introduced this type of program a lot earlier?
Well, my hindsight is perfect, but here in the now was collaboration with the federal government in an unprecedented way over the past 15 months, not just with British Columbia, but other provinces and the federal government. And I wanted to build on that as a renewal of Canada and a renewal of our federation. There was consent from the federal government to proceed with a national program. I had every expectation that it would be successful. Clearly, it has not met the test, and that's why we're doing the bill today.
Follow-up, Binder?
Yes, I just want to ask you also about the shootings happening in Metro Vancouver. Minister Farnworth said yesterday that we see this type of cycle every few years. So I'm wondering, what else can your government do that's not doing now to break that cycle? Or is this something that people just have to get used to, given the type of gang activity that we see here?
I'm appalled, as all British Columbians are, with the escalation of gang violence in the Lower Mainland and indeed across British Columbia in urban centres. And I'm confident that Minister Farnworth, working with police and other law enforcement across BC, will come up with new solutions and new objectives to meet this challenge. I was very, very heartened to hear through the media comments from law enforcement about their responsibility to take stronger action to curb this violence. And I know that the Minister Farnworth, has also reached out to Bill Blair, the federal minister, to talk about national challenges here as well. We need to make sure that we're focused like a laser on addressing the criminality here, and we have done our part by bringing in a whole host of programs. You know what they are. Minister Farnworth outlined many of them yesterday. The first order of business, of course, is to stop the flow of young people into the gang lifestyle, and that starts in our K-12 system by making sure that we provide other alternatives, safer alternatives for young people wherever they may live. And that's been our preoccupation, to stop the flow of people into the gang lifestyle. But clearly, the brazen nature of the violence we've seen over the past 2 weeks requires law enforcement intervention, and Minister Farnworth is overseeing that.
Next question is from Rob Shaw, Check News.
Oh, hi, Premier. So if the federal program doesn't cut it, how does bridging people into the federal program, which doesn't cut it, help them when they're stuck with that federal program after 3 days that pays them less than minimum wage and is a cumbersome burden? I'm just kind of figuring out how that actually kind of works for people.
Well, first of all, there are other programs that Minister Bains spoke about that we've already brought in. Presumptive COVID through WorkSafe, for example, if you contract COVID at your work site, you're covered by workers' compensation or by the WorkSafe legislation. This allows, these 3 days allows you to take the time to get a test and an appropriate period of time to get those results. And then you can make decisions about how you engage with the federal government for the programs that exist there, or through WorkSafe for the programs on that side. What we saw as the major challenge with the federal legislation was there was a break in payment. Minister Bains talked about low-wage workers were the most vulnerable because they desperately had to go to work because they're living paycheck to paycheck. The federal program interrupted the relationship with the employer and the employee and put the burden on the employee to make application for a benefit that would come sometime down the road. And that's the challenge here. We wanted to make sure that there was consistency of payment. We believe the 3 days covers that access, and then allowing employees to access other programs that are in place at the provincial level or at the federal level.
Rob, do you have a follow-up?
Sure. I also need to ask you, Premier, about the overdose deaths of 2 teens on the island, including a 12-year-old in your riding. The families have talked to us and said that they would like to see your government proceeding with Bill 22 on the involuntary treatment. And trying to get a sense from you as the Premier who promised this during the election, is that coming back? And if so, when?
It is coming back, and I wish that it had passed in the last Parliament. I've been pretty clear about that, and these very tragic examples of young people, inconceivable as a parent to think of a 12-year-old addicted to opioids and losing their life as a result of an overdose, when we could have taken steps to avoid that. If we have access to medical care, we should make sure that everyone gets that medical care. I firmly believe that. Minister Malcolmson is conducting consultation with those who didn't like the bill in its initial form, and she'll be bringing it back as quickly as that consultation can take place.
Tanya Fletcher, CBC.
We've heard from the Canadian Centre for Policy Alternatives on your legislation. They point out Washington State and Oregon require 5 employer-paid sick days per year, even in normal times. So, they're saying, why can't we do better during a pandemic? Many are saying this is a carbon copy of Ontario's, quote, woefully inadequate program. So if your government is only willing to do 3 days now during a pandemic, is there any reason to believe the promised permanent program will be any better?
Well, first of all, the comparison to Ontario is just not accurate. Their program, such as it is, will sunset in September. And we will be paying, and it's only $500, ours is $600, and it will be going provincially funded until the end of the calendar year. And as the consultation takes place, Minister Bains and others within government will be listening to those within Canada. Certainly I'll take a look at your suggestion at the American legislation, and if it's superior and we can gain support across the board, I'd be happy to bring that forward. I'm confident that the 3 days that we have in the bill will bridge workers to get access to other programs that are available in Canada, and if it becomes inadequate by December, that'll be clear, and we'll be making amendments, Minister Bains, through those consultations with the business community, with Labour and Indigenous communities as well.
Follow-up, Tanya?
Yeah, further to Binder's question just about the timeline of this, is this not too little too late, especially coming from a province whose premier has led the charge highlighting this nationally? We're well over a year into the pandemic. You were sounding the alarm about this, more than a year ago. So how many thousands of workers who needed it before now have missed out? And how many workers ill from COVID do you expect will benefit from this between now and year's end?
Well, as many as possible. I can't hide my disappointment at the lack of a robust effort by the federal government, but I do not want to be overly critical because they did step up. There was not a lot of support around the table. Sandy Silver, the Premier of Yukon, all 40,000 of his citizens have access to a program, but it's difficult to take a 40,000 person program and lay it over a 5 million person province. It was only recently, as you'll know, that Ontario got on board. Manitoba expressed interest, and they're bringing forward a program, but it too will sunset in September. I believe that we need to be sure that we're through the pandemic, and the end of the calendar year will allow for that. And 6 months to consult with business is appropriate. Would I have preferred a better outcome? Absolutely. But I'm doing the best with what we've got in the time available.
Next question is from Richard Zussman, Global News.
We've also heard from the Federation of Labor on the legislation. Laird Cronk says workers struggling with a COVID-19 illness face far greater than 3 days of lost pay. They face potential economic devastation. Ensuring workers don't have to make the untenable decision between staying home with symptoms or working sick to put food on the table is crucial here. So, with the fact that it's only 3 days and people will remain home for an extended period of time, do you think this is actually enough to ensure that people make that decision to stay home rather than go to work with potential symptoms?
Well, I do believe it's going to be sufficient to get that test done, to get the result from that test, and then to access the other programs that are available, whether it be through the presumptive COVID work that we did with WorkSafe back last spring, or accessing the federal program that currently exists, or long-term disability through the Employment Insurance Act, which I believe would be the best mechanism to deliver a paid sick leave program. I've made that abundantly clear as well. So is it sufficient for the moment? I believe it is. And will we improve it through the consultation? I certainly hope we do.
Richard, do you have a follow-up? Richard, are you there?
I am. One of the big gaps here from the federal program is how quickly, how people make that decision. So if someone in this case is feeling symptoms and their roommate or someone who lives in their house is not showing symptoms, can that person in the house also get support, or should they be going to work? Like, we know that, based on what we're seeing in closures in Fraser Health, that, this is an issue that's happening in those communities. We know it's a higher likelihood of intergenerational households. So is there support for people in the household? How do you even prove that you're showing symptoms? Like, how is it going to work in terms of preventing that decision from being made to go to work when you feel there may be risk that you can spread the virus to others?
The legislation provides for 3 days of paid leave, sick leave, and that allows workers to make that choice knowing that they're not going to have an interruption in their salary. That was the big challenge with the federal program. First of all, the quantum, the amount was too low. It would cover minimum wage employees only. This will allow for a top-up and a bridge for businesses that have higher paid employees, and it will allow for sufficient time to get a test done, to get a result from that test, and then to make choices about what the individual does from that point on, accessing any number of other programs. A hypothetical about who lives where and how is beyond the scope of the legislation. We're hoping that people make the right choices for themselves, their families, and the businesses that they work in, and that's the intent here. And I have to say that on balance, British Columbians have met that challenge over the past 15 months with great hardship in many instances, sacrifices by workers, sacrifices by governments. But despite that, we've got to this point where we've had, as of this morning, 49% of those eligible for vaccines have taken up a first dose. Over 2.1 million British Columbians. We have a steady stream of vaccines coming into BC. People are registering in record numbers. This is all positive news, but we are not out of the woods yet. That's why this legislation is so critically important at this pivotal time. And I'm confident that leaving it in place and funded by the province to the end of the calendar year will give us the time to have the discussion about how can we refine this. I left it to the federal government to do this work because they said in good faith they would do so. It didn't meet the test of workers, and so we need to pivot and make amendments, and that's what we're doing today. Government is all about taking circumstances as they come your way and making the best of it for the people that you represent, and that's what Minister Bains and I are announcing today. And if there are improvements that we can make between now and January 1, we'll absolutely do that.
Next question is from Katie DeRosa, Vancouver Sun.
Hi, Premier. You are continuously saying that the federal program is inadequate, But again, the current program that BC is coming up with only provides for 3 days, and then people have to go into, what you're calling an inadequate measure by the federal government. So again, why not have a longer period of time to cover people so that they, because again, the federal program, they have to apply, and it could be weeks before they get that money, whereas the provincial government would provide the money, to employees. And, the Yukon, I think, has had to have 10 days. So, why, again, only 3 days, which is comparable to the Ontario program, which has been criticized.
Well, I don't know what I can say, Katie, to allay your concerns about this. There are a range of programs available that we brought in and the federal government has brought in to protect people. And when it comes to paid sick leave, it's been inadequate. We believe the 3 days covered by the province will bridge people to either the CS, the second CERB, or unemployment insurance, or the presumptive COVID regulations that we brought in that will protect workers who contract COVID in their workplace. That then becomes a workers' compensation question, the only province in the country to do that as well. I believe that we're circling as best we can around this challenge, and I'm confident that what we brought forward is certainly superior to the program in Ontario in terms of the quantum of dollars, as well as the fact that we are not only carrying it on 3 months, 4 months past the expiry date in Ontario, but we're going to make it permanent January 1. In addition to that, and I was very grateful for the support of the Yukon when I was making my arguments, but let's be candid, 40,000 people in the Yukon Territory does not translate as easily to 5 million people in British Columbia.
Follow up, Katie?
Yes, on the issue of the release of COVID data, yesterday in question period, yourself and Minister Dix were, saying that BC's been releasing, as much data as possible. But this week we're getting a commitment to more data that many would argue would not have been released if, reporters were not, and epidemiologists and medical doctors were asking for this information. So why this delay? 15 months into the pandemic, are we finally getting this more neighborhood-specific, age-based, sex-based data?
Dr. Henry and the Centre for Disease Control here in British Columbia collect the data. They make decisions about what to do with the data. At no time have I given any instruction or direction that they do anything particular with it. I know and I am confident that Dr. Henry and her team use the information to shape policies to protect British Columbians. My role was to back them up, and I'll continue to do that. We have a challenge ahead of us, so we're very close to the end. 2.1 million British Columbians have received a first dose. 49% will be at 50% before you know it, and more vaccine coming. The data issue was in the hands of the BC Centre for Disease Control. At no time did I direct them to do anything other than to utilize that information to protect British Columbians, and we're going to continue doing that. If Dr. Henry and the team are in a position to release more information, that's good.
Les Lane, Times columnist.
Well, thanks. Premier, do you have a ballpark estimate of what the COVID sick leave will cost and what the permanent one? Is there like a nominal figure you're expecting to budget for?
Go ahead.
Thank you. As you would appreciate, it is very difficult to actually come up with the real numbers, not knowing how many workers will actually take advantage of this. As we see, our vaccination program is ramping up and more workers are being vaccinated. So I think it probably will have fewer workers utilizing it as a result of our vaccination program. But I think at the end of the day, when you look at where are the benefits and the cost, I think the cost of not doing this is much higher than the cost of providing this service. But if the estimates are correct, as I think they should be, 50% of the workers in British Columbia don't have any kind of sick leave provisions in at their workplaces. And based on if the 60% of them take it or utilize it between now and December, we're looking at about a little over $300 million.
Les, do you have a follow-up?
was just wondering, the Premier's estimated the federal program at $2.6 billion, and there's only $400 million take-up. Is that, can you just outline what you read into that skimpy kind of take-up? Is it still, money still going out the door? Is it a delay? Or does that illustrate anything other than the program wasn't properly designed?
Well, I'll take a shot at that, Les, and then perhaps ask Harry, who's been more intimate with this information. But it seems apparent to me, and what I heard from workers and from businesses, is that the disconnect between the worker and the employer meant that there was a disruption in flow of monies to workers. And if you're going from paycheck to paycheck, the thought of taking 1, 2, or 3 days to determine that you're well enough to continue working, if you're going to lose those 3 days of pay while you wait to fill out a form and then have the dollars transmitted to you from the federal government, you're going to say, well, you know, it's easier for me to go to work. And that's what we want to stop people from doing. That's what we were focused on 15 months ago. That's what we were focused on into the fall last year. And that's certainly what we're doing today. Again, would I have preferred a more robust federal program that did work directly with employers and employees so that there was a continuous payment to those who desperately need it? Absolutely. We believe that this measure will assist us in that regard, and we're going to consult widely to see if we can make it any better going forward. And I know that there's very much interest in the business community to make sure we get this right, as well as within labor groups. And I think that striking that balance is critically important at this time to make sure that there's continuity of pay for workers and that we're not putting a whole bunch more burden onto already strapped businesses. And that's why the long duration to the end of the calendar year before we implement a program that may well have impacts across the board. But do you want to touch the federal piece?
Thank you, Premier. I believe it's hard to speculate why there is such a low uptake on the federal program. I could only comment that there are a couple of gaps that existed in that program, and we have identified with our counterparts in the federal government. Premier has been very consistently talking to the Prime Minister and the Finance Minister, and I've been talking to my colleagues across across Canada and the Federal Minister of Labour. I think the gaps, for example, you must lose at least 50% of work or income in that particular week to qualify. I think, you know, that could be one of the reasons why many workers, you know, do not want to take up on that program, and we are here to fix that gap. And I think the other part is the $500 is less than our minimum wage here in British Columbia. That also is a disincentive for workers to take time off, so many ended up going to work sick sometime. So I think, you know, the gaps are the one that need to be fixed, and I think we identified those gaps with the federal government, and they didn't act on it, and now it's up to us to fill those gaps. And the other part that I would say is that the federal program does not allow provinces to top up on the $500. So I think so we had to make the best out of the situation that we're in, filling the gaps that are left by the federal program. You know, we always believe that it's a national emergency. There has to be a national solution, and we work with the federal government. And here we are to do the work that we need to do in order to fill those gaps.
We have time for one more question today. Lisa Houston, News 1130.
Hi there, Premier Minister. Just wondering about the timing of the reimbursement. You know, we've heard about the circuit breaker program where people are approved, but then they're waiting a long time to get their money, and wondering how long are companies going to have to wait to be reimbursed here, because a lot are, you know, like their employers, you know, living very close to the edge.
That's a good question, and that's why WorkSafe has stepped up, and we're grateful for that because there's already an existing relationship with that organization and employers across British Columbia. Some of the other programs, whether it be the circuit breaker or other initiatives that we brought forward, were brand new programs that didn't have a delivery mechanism. We had to put in place criteria, test all of those criteria against actual results, and we've been improving over the past 15 months in our ability to deliver those programs effectively. And in this instance, we're able to take an existing administration that already has a relationship with employers, and that will, I think, accelerate the ability for us to get those dollars to those employers quickly. But maybe, Harry, you want to add to that?
Thank you. Because we are utilizing WorkSafe BC and they have existing program, the relationship with their with employers, so it will be much faster than designing our own, as the Premier have mentioned. So the WorkSafe BC have assured us that they would be able to put this program in a very short period of time, and then the turnaround time would be as short as possible because they will have a system in place where online applications will be made, and the WorkSafe BC will be easily transferring those funds to the employers in a timely fashion.
Lisa, do you have a follow-up?
Yeah, I'm going to go for broke and ask a double-barreled follow-up here. With the circuit breaker, 10,000 businesses have applied, only 3,600 since the whole start, like way back in the fall when this sort of small business loan started. Only 3,600 have been approved. So I'm just wondering what you think about the pace of that, and just a little side one, if I can toss it in. Is BC looking at following in Alberta's footsteps when it comes to AstraZeneca and sort of nixing the use of that vaccine?
Well, I'll say that Minister Callon has amended and accelerated the circuit breaker resources. My understanding is that that's moving quite well. Businesses satisfied that they're getting access to these programs. We have another range of programs we'll be announcing later this week or into next week about the tourism sector as we look to almost 50% immunization to this point in time. So I'm confident that those programs have always been tweaked and improved. I want to lean in a little bit here and say that this is uncharted territory, and it has been for a year and a half. That doesn't make it easier with each month that goes by. It just reminds us that we haven't done this before. And so when we develop the programs, we learn from them each and every day, and we improve them as best we can, and we'll continue to do that. With respect to AstraZeneca, again, my wife and I were immunized with AstraZeneca. I fully expect to get a second shot when I'm advised that I'm ready to go. And I know my spouse feels the same way. Countless numbers of British Columbians have benefited from the AstraZeneca vaccine. I'll have to take a look at the decision made by Alberta at this time. It could be because they have such a supply of Pfizer coming in as we do here in BC. But our view is that those decisions are best made by public health officials, and until such time as Dr. Henry, Dr. Ballum, and their teams advise us that we'll continue with the programs that we have in place. We believe that the vaccines are safe, they're effective, and we urge British Columbians to take the first vaccine available to them in the interest of not just themselves and their family, but their community and the province.
That's all the time we have. Thank you for joining us.
Thanks, everybody.